for people to do it. In talking about cash, and you say we, who makes up cash?
Oh, that's a great question, and thank you for asking it. It's one of the things that makes us unique. Our key sponsors include Carolinas Medical Center, Presbyterian Healthcare, Pfizer, Bank of America, and then I've already told you about the institutions of higher ed, Johnson C. Smith, Pfeiffer, Queens. Winthrop has participated with us for a while, in UNCC. And then we also have at the table neighborhood associations, faith-based groups. The Native Americans are a part of our group, the Lumbee tribe in specific, and the health department works very closely with us. So we are a partnership-based organization, and we find that when we have all of the right people at the table at the same time discussing the same issue, solutions can be found.
How old is Cash?
Cash is 5 years old if you count the year of just doing our informal talking. But this is, we were actually incorporated as a nonprofit organization in 2005.
Okay.
Yeah.
One of the things that we talked about was the fact that the not-for-profits play a role in trying to give people access and information and education. Do you think that the not-for-profits can handle this dilemma that we've got?
The problem is just too big for the not-for-profit system. We in America are unique in the world for the role that we've given nonprofits, what in other parts of the world are called non-governmental organizations. But the problem of health care is just so expensive. We're now spending 16% of our total gross national product, that is all the income, wealth produced in America, 16% goes for health care issues. This is a national problem. We in Mecklenburg County are very fortunate in that we are a relatively wealthy county for North Carolina. But in the eastern part of the state, where you may have 20% of your population may be on Medicaid or welfare because there are no jobs, it's very difficult to have this nonprofit system offer the same level of services. So I want to really emphasize that everybody I know involved in Physicians Reach Out, we have the same group of involved and concerned people, the two hospital systems, Pfizer, and as well as the Medical Society and the safety net organizations. But all of these organizations, I have yet to find anybody who thinks this is the solution.
Right.
We're like the Dutch boy who has his finger in the dike, keeping out the deluge. But at some point, with increasing healthcare costs, with the aging of the baby boomers, we're going to have some kind of national solution. And we'll be hearing more and more about that in the upcoming presidential election that's already started.
We had a speaker recently, Trina Palmer, who runs the senior centers, and was talking about the number of people 85 and older, and the issues surrounding health for that population. The number one is the health care. And the quality of life for folks. One of the things I mentioned at the beginning of our show was prescription drugs. Do you think that people are getting the access that they need? We have a United Way agency called Medisys, which tries to help people who cannot afford their drugs. But are you seeing much of that in Cash or in your Physician Reach Out?
Well, there's been an important evolution in Medisys with the passage of a drug addition to Medicare, which serves the people 65 and over. Medisys transitioned in conjunction with PRO. It was a big involvement of the group, the leadership group of Physicians Reach Out, because Medisys and Physicians Reach Out work closely together, so that really Medisys has become a community pharmacy. It's no longer restricted to older Americans. It can be anybody who's low income. And that's been a vital addition to the health services available in Mecklenburg County. Again, other counties in North Carolina, most of them won't have this kind of a situation.
Program.
The other thing that's also been important is to note how some of the discount drug organizations, I think I can say Walmart, for example, is famous, have with selected drugs lowered the price for their own commercial reasons, but that has really eased the problem of getting the common drugs. Drugs are still really expensive, and if you don't have private insurance and you have a condition which isn't covered these, and if you're above the level at which you qualify for Medicist, you may still spend a lot of your income on securing drugs.
Dr. Miller, in your symposium that's coming up next week, why is it important for someone to attend that symposium?
Well, it's important because, as you know, as a nurse, your customary and usual physician-patient interaction time is 2 minutes or less. But at a symposium like this, our workshops are designed to be very interactive. And so you have the leading physicians and healthcare providers who will be there that you can talk to personally. We've had people in the past who were able to access or get help for what they needed simply because they were there and attended and were able to talk to the right people and get help. So that's very important. Again, we will have a vendor area, and those vendors give out just the absolutely fabulous information that sometimes your average person wouldn't be able to get otherwise, that they can take back and share with large groups of people. So that's important. And then one of the things that we have to do nationally and locally is encourage people to change their own personal health behaviors, to adopt healthy lifestyles. So by coming to the symposium, they can get information on how they can change their personal lifestyles, which will improve their health outcomes before we even get into the system and need these expensive drugs and to have to access physicians at a higher level. I think that's very important.
And one of the takeaways from that is something you mentioned earlier about prevention. You know, we have so little opportunity, and sometimes to educate people before they find themselves in crisis.
Exactly.
Is the symposium open to the public?
It is open to the public. We would like to know that they're coming so that we can plan for that. So even at this date, they can call 405-5600. That's the area code 704-405-5600. And we have some scholarships available.
Very good.
Our sponsors have been very generous. And so individual tickets are $45. They can also register online, but if they are not able to afford to pay, we're able to accommodate them if they'll just let us know that they're coming. We may not be able to accommodate them at the door because lunch is served. So we need to be able to prepare for that, but we'd like to see as many people come as possible.
Well, I have certainly been to it, and I think it is a wonderful opportunity to get up close and personal and not just be talked to, but be also able to be interactive with what is going on in people's lives and to ensure a better quality in terms of health care.
Could I return for a minute to the question you started off with about dimensions of disparities?
Yes.
And this really fits in a lot of what we've been discussing. One of the